a medical doctor, and I train an obstetrician gynecologist, and I practice obstetrician gynecology for about 30 years now. And in the course of my clinical work, I found that yes, you can treat women individually and you can make impact, but you find that women with repeated pregnancy problems do arise. And the major causes of maternal mortality are not unconnected with the frequency of delivery and the interval. I mean the number of times that a person has to go through pregnancy. And so if you are to make an impact in reducing maternal mortality, I mean the perfect approach is not to have pregnancy. Right, but we can't do that. But you can space your children and you can have few children, so that you do it only a few times and at interval. And it makes sense. Not only do the children survive and the mother survives, but economically, socially, developmentally, it is more advantageous to have just enough children that you can look after and you can manage and you remain healthy and you live to see them grow through their own adulthood. So this kept on attracting me to not only family planning, but working at a wider level, not just talking one-on-one on counseling on family planning. Seeing women go through pregnancy, seeing the complications, seeing how many of them die for things that we can prevent, we can intervene, and seeing that if did they really need this pregnancy? This is the 10th pregnancy, the 11th pregnancy. I've seen almost the 17th pregnancy. She was lucky she survived, but all right. But I mean, she is taking a risk every time she conceived beyond the 5th child, really. So that really took my interest far outside the clinical rooms, and I started doing developmental work. And I think for the last 10 years, even though I mixed the community activities, national activities with clinical work, I spend a lot of time doing more at policy level and more at community level, trying to promote good reproductive health. At our present state of development in Nigeria in particular, everything that you want to do in this country must get the blessing of the government. The government control all the resources of the country. They give the policies. They provide the enabling environment for everything that you do. So government support in every activity at the present development is very important. Without that, you find that you cannot succeed. Because I was involved in setting up post-abortion care services in Kano State, one of the 36 states of Nigeria, one of the largest in terms of population. And we train well over 200 midwives and about 50 doctors in post-abortion care services, including the use of the manual vacuum aspirator, the MVA. And setting up, in every secondary care level and some primary health centers, post-abortion care units. And one component of that post-abortion care unit was a post-abortion family planning corner, where women who have had abortions can be counseled and be provided with some family planning counseling, and also services if they desire to have the services at once. Otherwise, they are referred to family planning clinics. It was really such an excellent program that was needed a lot of scale up within even the state. So we were able to, after the training and establishing the units, we also included this under the state free maternity service program, which meant that the state government supported the services and women had access to post-abortion care easily. and in their very close, within their environment, because these also were, some rural hospitals that were able to provide basic services, and there was no need to have a doctor. There was no need to have electricity. I mean, it was not necessary for the service, and we're using high-level disinfection for cleaning the instrument, sterilizing the instrument, and it was really very successful. Of course, there were challenges. It was felt like being, in Nigeria, abortion is illegal and under the laws, and so people felt, oh, what we are training was train people to, do abortions in public facilities, and but that was investigated. It was not found to be true.